Here we go. So yeah, I'm Hannah from North Herts and Stevenage CVS, and thank you to Lee for setting this meeting up. And yeah, welcome to Frank, who's going to be I think giving us all the latest on COVID and the new variant and what we can do to protect our organisations, ourselves, and our service users. So yeah, welcome, Frank.
Hi guys, I'm hoping my voice and throat lasts out. It's nothing to do with COVID. I've had this for about 18 months, 2 years now, so it's just me, I'm afraid. It's the new me, probably working from home in the lights. I have no idea if any of you know me. I've spoken with one or two of you, I think, in the past. I recognise a few names, but welcome. Thank you for inviting me along. Certainly what I'd intended to speak to you guys or go through with some of the information with you guys only as of yesterday afternoon has sort of changed and gone out the window, and we've got new information and new guidance and such like, so it's going to be a little bit of a wing and a prayer job, and I think largely because of the so rapidly changing environment that we are working in, not just with COVID generally, but Omicron specifically. I think it's going to be a bit of a Q&A session if that works for you. So what I'll do, I'll give a very brief introduction of who I am, what I'm doing, all this sort of stuff. And then probably an even briefer summary of what we would be expecting of the organisations in the district. And then open the floor to any questions. I think that might be the easiest way of doing it. Okay, who am I? Frank Harrison. I'm the Environmental Health Manager for North Herts District Council. I've been there for just over 2 years, I think. No, just under 2 years. So I joined just in time for COVID. What would you do? So everybody has been on a massive learning curve and a change of regime because of COVID. Certainly my service, which is environmental health, as I said, which is responsible for food safety, health and safety at work, for private residential dwellings, for pollution issues, and a load more other things. We massively had to change our direction of service, trying to identify how and what we could do as far as COVID is concerned. And even though we think we've got a reasonable grasp on the idea, as I said just now, with the very rapidly changing environment that we find ourselves, sorry, that's my chair. We find ourselves, things are changing literally overnight. So we'll see how we cope with it at the moment. My team at the moment includes essentially 3 groups. One is looking at private sector housing, nuisance complaints, problems with your neighbours and the like. One is looking at the commercial sector, which is the food premises predominantly, but then also infectious diseases other than COVID. But then I have a dedicated COVID team. And it's some of those who you may have seen if you've been out in the streets, especially in our town centres. The North Herts COVID Marshals, they are mine, they are from our team, and they are tasked to work with whoever to essentially give the latest guidance. They probably have the hardest frontline work as far as COVID is concerned in just trying to keep abreast of the information. And one of the tasks they've got this morning is trying to understand what was actually rolled out by Boris and co yesterday afternoon. So I certainly don't envy them because they're in the public domain far more regularly than I am. Okay, what's happening as far as COVID? Essentially, I don't know what you know, so apologies if I overlap any information. I'm going to localize this more than give you the general picture, because I would advocate you refer regularly to the trusted news media that you should look at. I tend to look at the BBC COVID pages, which is as good as anything else. It tends to be more locally proof tested, so it's more UK specific than some of the other courses. And I would certainly advocate looking at the BBC Corona pages. In addition to that, I also get a hell of a lot of information through regarding the local picture for COVID. And the 2 main documents I refer to, which I will be alluding to at the moment during this very brief intro. They are a daily situation report of COVID in Hertfordshire, and including the rates in North Hertfordshire, but then also the situation with our schools, not just again in North Herts, but across the county. As far as the COVID situation in North Herts, the rates are very, very high. We are certainly among the highest in Hertfordshire, and we are therefore amongst the highest in the country. This information is publicly available. You obviously won't have the information that I have access to, but you have access to the overall figures. As far as the rates for North Herts, we've had a very high level of COVID cases in our district for probably a good couple of months now. And as a result of which the community spread infection rate is very, very high. The incidence rates in our local schools is also very, very high, and the evidence suggests that the infection is going from schools to community and vice versa, I stress. And clearly with cases being in families, it will go through a family, and although the request is for that family to isolate as much as it's possible, there is a period of time when the infection rate will spread in and out of the family and that community without people knowing about it. I'm very pleased to say that the age group probably least affected at the moment are those that are 60 and above. It is the rates for those is higher than it has been, and certainly higher than we would like, but it is nowhere near as high as it is for the other age groups. So I'm very pleased that my colleagues in the care home sectors are doing an excellent job on that. Okay, I don't know what information you guys have seen regarding the latest legal requirements. I sent through an email which was yesterday. It came from the OPSS, which is one of the government's department, the Office of Product Safety and Standards. It's one of a number of sources that we get, but it summarised the latest legislation covering face masks and access to buildings and so on and so forth. I sent that through to Claire, Lee, and others, and I'm not sure if that's been passed forward to you guys, but it's available if you wish to. Again, the legislation is available out there should you wish to look at it. But essentially, as far as the law is concerned for premises, and by all means pass this information to your contacts, your colleagues, other community workers and the like, the legislation as of today is that at the entrance to any building, there should be a sign saying, please wear face masks. It's the building's responsibility, or the building owner's stroke manager's responsibility to have that sign now. The only slight exceptions are into the food businesses, restaurants, cafes, that type of place, where although there is a requirement that people should still be wearing face masks while they're circulating, clearly there is the exemption that if you're eating, drinking, etc., you don't need the face masks. If you advise your colleagues that if they come across a premises where there is no sign at the doorway, by all means, please refer the, please pass a message on to my colleagues, put a complaint into the COVID Marshals, and we'll speak to that business and remind them of their obligations. But the lack of sign, again, if you pass this information around, the lack of sign shouldn't preclude people from wearing masks. Masks still do play a very effective part in controlling the spread of the virus, as you've probably seen on the adverts on telly. Unfortunately, we don't see that black haze, that black mist which emanates from people. If we did, it'd be a damn sight easier to control it. We just get a big Dyson and suck it all up in the first place. The other aspects as far as the legislation that came through is looking as far as the provision of notices, templates and enforcement documentation. Although that is geared predominantly for us in the enforcement sector, it's also available for businesses to then use their own versions of that. For example, to put notification, signage, etc., into their building, so their community users, their public, their staff who use those premises can then also look at that. Okay, that's only a very small part of the stuff that came out recently. As far as the excuse me, as far as a messaging that I would like you guys to pass on, well, as I say, my idea for the conversation changed yesterday afternoon, and I've been in meetings all morning as to what regarding this particular issue. Essentially, the government, and therefore us and yourselves also, need to be conscious of two very significant aspects as far as COVID, as far as the future development and management of COVID. First one is that we need to push the uptake of vaccinations in and around our areas and your communities. Generally speaking, we're not doing too badly as far as vaccines are concerned as a raw percentage, but we have a number of pockets of groups of people, both geographically and from a community basis, where the numbers are quite low. Clearly, I'll put up now my colours to the mask. I'm a firm advocate that everybody should be vaccinated. Clearly, we're not allowed to require that. We can't make people be vaccinated, and there are restrictions on that. But if you or your colleagues are speaking with people, then can I just request that you pass that message on? Please encourage everybody you liaise with and speak with to get vaccinated as soon as possible. Now, having said that, I'm very conscious that within North Herts, there are a number of geographical areas where actually getting vaccinations is increasingly difficult. One of the particular areas where I'm aware of a major problem is Royston. It's not alone. There, the vaccination centres, for want of a better term, were stepped down pre-Omicron, and there is in the process of trying to source another venue, another premises, reopening the primary care network in Royston area so that we can facilitate a bigger uptake of vaccination. I don't know if any of you guys do cover the Royston area personally, or you of your teams, but you may be aware that we've recently still undertaking a big publicity campaign in the Royston area to promote the fact that COVID is still a risk and still a problem. And one of the key aspects of that is we were looking to bring him into the area, into the town, a public vaccination centre, either the vaccine bus, and yes, it does exist, and we're looking to put that into the Tesco's car park there, or we were looking to use other buildings in the area, possibly including some of the old buildings in the Royston Town Hall. They're still in progress. They've been sidelined at the moment because of this national campaign to try and increase the uptake of vaccines. But as I said, if you're able to speak with all of your colleagues, all of your officers, all of your charges, and encourage the uptake of vaccination, that would be very, very grateful. The other aspect which we are trying to run in parallel is to prevent the spread of COVID. Now, clearly you will have seen, as everybody else has, that there is a major drive to encourage people to work from home. Obviously, that's not available in every instance. A fair proportion of my officers are not able to realistically work from home much of the time. They have to go into the office, but clearly even with those, where they are able to work from home, they will do. And we are a frontline COVID response service, as well as a regulatory and enforcement service. Again, if people don't have the facilities at home to work, then obviously there is very little option, they have to go in. But if people therefore do need to travel to work, go into the offices, etc., the request is to be very vigilant regarding the COVID measures. So that is wear masks when you're circulating, whether you're required in the building to do so or not. Maintain good personal hygiene, use sanitizers on your workplaces, your work desk, your door handles, before and after you go into the premises and work at your desk. Even if you're working within a small team, then please be conscious where possible of that benefit of social distancing. The virus does spread indoors, but its spread is significantly restricted, at or around that 2-meter mark. There isn't anything new in all of these requirements, these situations. It's just reiterating the same thing. Also, if you're able to meet outside, even better. If you can increase the ventilation into your rooms, into your meeting rooms, into your offices, literally open a window for a while, that helps. One of the questions we are regularly asked is, it's cold out now, do we need to keep the window open? The guidance for the ventilation aspects of COVID is that the windows are open periodically and occasionally. Clearly, if you're able to meet outside, brilliant. If you're able to leave the windows open all the time, even better. But you just need to open the window enough to allow good airflow rather than cause a cold draft. A lot of places are starting to obtain and use carbon dioxide monitors, and the level of carbon dioxide is linked to, or it's a visual representation of the presence of virus in a room. If you look at the Hertfordshire Local Enterprise Partnership web pages, which is a Herts LEP, I'm happy to share that information in the website with Hannah, with Lee, or whoever as part of this group subsequently. But if you look on their web pages, they are providing quite extensive guidance for businesses. Now, although I appreciate you are not technically a businesses, if you look at their website, their information, most of the guidances will also be applicable and very useful for you. So I would advocate looking at that information site. But as far as the ventilation is concerned, if you're able to leave the window open, as I said, do so. Otherwise, a few minutes at a time, several times an hour, open it, close it, that sort of thing, that tends to work very, very well. Also, the evidence has shown, especially if that is combined with mask wearing, sanitizing, distancing, and so on and so forth. Okay. I referred earlier to some of the meetings I'd had this morning. And part of the aspects of those meetings was, as I said, in trying to encourage the uptake of vaccinations in and around the communities. One of the aspects of conversation is whether or not there will be a specific request for community groups in the respective local authority areas across the county. That is being looked at, and that is being considered at the county public health COVID level, the strategic level and the operational level. Although at the moment there is no clear plan as to what that request would be, and it's going to be worked on the rest of the day and possibly into tomorrow. As soon as that request has been formulated, I will happily pass that information on. It is a request. It isn't a requirement. So if any of you guys are able to pass that request on, if you're able to help in any sort of way, it won't be a good mark for you, bad mark for you if you do or you don't. But that request is likely to be forthcoming. And this is literally hot off the press from less than 2 hours ago now, that you are a sector of the community who are potentially going to be asked to help support the COVID measures in not just in North Herts but across the county where that's applicable. Okay. Another aspect which has been agreed, for want of a better term, communications regarding COVID has been ongoing throughout the entirety of the pandemic. I have no idea who gets what communication, and there's very high likelihood that people will end up getting several versions of the same thing, including possibly from me having sent several emails out to different people. If you're getting inundated from emails from me, I do offer my apologies, but I won't stop doing so. Certainly the stance that I take and most of the communications group take is you're far better to get them the same information several times and then bin it rather than not get it at all, especially regarding measures to try and control COVID. However, one of the aspects that I've recently had agreed, for some reason, not all of you were included in all of the communications forums. That's well, I've now got agreement that I can forward that information onto your contacts. So for me, it's Claire, Ashley, Lee, and Mohammed. I don't know who you liaise with, but going forward, I shall make sure that either I or my COVID manager does pass that information on to you, so you can then look at it. We will then obviously be available for questions, what the hell does this mean, and so on and so forth as a result. So please use that information and use us as a resource to clarify. Okay. Hopefully that gives a reasonably brief summary and update of where we are. And as I said, the situation is changing literally as we speak. But I mean, I'm sure I haven't given you that much more information than you probably already know. May have just focused on a few things. Can I therefore ask if anybody has any questions, and they're quite happy to do so, by all means, stick your hand up, ask, shout, whatever, and I shall try to answer any questions you may have, either at a strategic national COVID level, or even as far as the application, or as whether you should let so-and-so into your building, at your very, very localized level. I'll see what I can do.
Hi, I'm technically not North Herts because I'm
I'm not allowed to talk to you, go away.
Not allowed to talk to me, but no one else has talked to me. So
my colleague over in Stevenage is also in a similar position and hasn't yet got to the YouTube focus thing, as far as I am. But so please ask away, Helen.
So I just really want to ask about policing. We've got notices up, but I know I've said to our part, because we're a community centre, I've said to our parties, actually, it's up to the hirer to enforce it, not us, because we're not there. And I'm not stopping people who walk in and saying, put your mask on, because I don't want to be thumped in the face or anything. I'm sure most people won't do that. But can you give any guidance on what we should do for this sort of thing?
I can certainly give you some. Now, for those who didn't quite hear what Helen asked, was essentially what's the provision as far as enforcement or restrictions to allowing people into the various buildings that you're responsible for. Firstly, Helen, I hope you've got a sign at the front of your building saying wear a mask. Okay, what the law actually says, and the law here is very contradictory, and it's been an issue where myself and other regulators and enforcement officers, including my colleagues over in Stevenage, have been raising as a problem since essentially the relaxation of the legislation last summer, early in the summer this year. There are several bits of legislation that relate to this. All of the COVID legislation, which says you must do this, that, and the other, and certainly the one which said you must wear mask, was previously rescinded. The latest information, the latest legislation that came out just a few days ago, which now says you must wear masks in these environments, has been enacted, and I'm sure you're aware that legislation was passed in government yesterday. So that is now enforced. What that requires is that businesses, premises, including community centres, have the signage up, and that the public, individuals, can wear those masks. Okay, so that would differentiate. You're required to put the signage in place, but the members of the public are required to wear masks. You are not therefore required to regulate and enforce the public. Okay, under the COVID legislation. And if you come across any situations where people are refusing to wear masks, then you can contact the police and the police can come and assist. Okay. Having said that, there's going to be clearly a time delay between when the person you're speaking to wants to smack you in the head and the police being able to respond to it. Okay, so do not put yourself into any dangerous situation. Okay. That's my guidance, that's the law, that's every bit of common sense. Okay, try what you can, but don't put yourself in any risk. Any situation where the members of the public are not wearing masks can be referred to the police. In the circumstances for you in Stevenage, I think you can contact your, I think they're called community COVID marshals or community marshals, I'm not sure. Certainly over here in North Herts, we have COVID marshals. We have 3 officers who are now working full time, and they can be contacted, they can be asked, and they can, come and give you assistance. But do not put yourself into any danger. The contradictory part of that guidance is that the Health and Safety at Work Act still applies. And what that says is that every employer shall take every measure that's reasonably practical to ensure the safety of their staff and the public who interact with their staff. So essentially what that is saying is that you as an employer, and community centres and managers of community centres fall under that category as well, are required under the Act to make sure that you do not let people into your premises if they are posing a risk. Okay, so you've got the regulations for COVID, which says, as a message from Lee, says, apologies everyone, my Zoom is decided not to give me any sound. I'm not going to comment on whether or not we want to hear Lee say anything, but if you have any messages for her, oh, she can't hear us either. So we'll liaise with Lee in due course. Yeah, sorry. So what I was saying is there is a contradiction between the Health and Safety at Work Act, which imposes the powers on you, and it's for us to then enforce that aspect, whereas the COVID regulations are far more lenient. So we struggle with this as enforcement officers. We could, in theory, come in, be very heavy-handed, very good draconian, and say, you've just allowed somebody walk into your premises who isn't wearing a mask, who's breaking the COVID rules. What are you doing about it? We're not going to do that. Okay, the legislation is so contradictory on this. The legal guidance is so contradictory on this that I'm not aware of a single enforcement officer, either in Hertfordshire, certainly in Hertfordshire, and countrywide, who will enforce this. Clearly do your best, okay? And one of the approaches which appears to work more so with people who are reluctant to wear masks is, you know, take the stance of, by all means, you don't have to wear a mask, but the mask is to protect the public from that person, but it then also acts as a barrier from that person getting infected. Now, whether they want to get infected with COVID is entirely up to them, but if they do get infected by COVID, they will affect their families. They will affect their neighbours. They may affect someone who they are more concerned about. And the last thing most people want to do is affect someone they care about. It's a little bit tugging at the heartstrings, but it does work. Now, whether or not you want to speak to that person, whether you want to modify the sign saying, please wear a mask, you are also protecting those you care about. Something as poignant as that, do so. You're never going to be criticised because there is no law stopping you doing so. You might find somebody doesn't like the sign. I'll leave you to challenge that one. Okay, sorry, that's a very, very long-winded reply, Helen, and I hope that covers your approach on that. It is a difficult situation and it isn't clear.
Thank you. Yeah, I have informed all my hirers that they're responsible for their groups because we're not here, and parties. I've told party hirers they must.
Yeah,
I can't enforce that again, and I'm sure no one's going to come and stop a party at the moment.
Well, at the moment, not yet.
Anyway.
Wait and see in a few weeks' time. One of the things I was going to say was that you are referring to a contractual obligation. You have a premises which you're hiring out to a customer. You actually have a lot of regulation and power within that, above and beyond what the health and safety law and COVID law says. You have the provision of saying you can only hire this premises as long as you adhere to these requirements, wear masks, distance, sanitize, etc. Now, clearly, you're not going to regulate that on a one-off hiring, because if they hire it, great. If they comply, even better. If they don't, we're going to do about it. But if you have any members or hirers who periodically and repeatedly hire your premises, if you hear that they are not complying with your requirements, you have every legal right to terminate that contract. Okay, there is then nothing that anybody can do to force entry to your premises if you have terminated that contract. And if you decide that you're not coming in without wearing masks, and if you don't wear a mask, you're not going to get the access to the hall, you have the legal right to do that.
Okay, thank you.
Any other questions from anybody other than Lee who can't hear us or talk to us? I can't see any hands at all, so if anybody does, please shout. Oh, I can see Sue, just about to see Sue.
I'm just a question, just a statement really. I'm a small community group, so I'm here really just as peace of mind, so I can spread it along to my other people, sort of thing. So that's why I'm here, really. Just so that you know.
No, that's fine. And I mean, I said earlier on, I have got 3 COVID marshals. Their role is to go out into the community and speak to the community.
That's good.
If you want to use any of my COVID marshals, they do have a number of other priorities I hasten to add, but if they're available, then by all means contact me or my COVID manager. If they're available, if they fancy a wander out into the district, you know, and see some of the more delightful rural parts of the area, then please do. They tend to focus around our town, so Royston, Baldock, Letchworth, Hitchin, etc. But they do occasionally go out into the sticks. I've not yet lost one, although sometimes it takes a while for them to come back. But seriously, if anybody wants one of my COVID marshals to do walkabout with you guys, give us a shout. We're more than happy to at least consider the offer or the request.
My group deals with emotional needs of people with acquired disabilities, so it's just nice to have that sort of like reassurance. So thank you very much.
Absolute pleasure. Yeah, no trouble at all. Any other questions from anybody else? I'm assuming Hannah's finishing her meal off. So
Oh no, that was literally in the first 5 minutes, Frank. But yeah, no, that was really useful, and it's good. And obviously, if we have any further questions that come up, we'll obviously send them your way. But as I say, just to remind everyone, we've got a large quantity of lateral flow testing kits available if you need them to give out to your service users. And we also have hand sanitizer left. So if you need anything from us, or if you've got any questions about, you know, running your centre, or what to think about risk assessments as well, you know, we're there to support you. So yeah, just get in touch, and yeah, hopefully we'll come through the other side again fighting.
Absolutely.
Like we have before.
If I can just add to Anna's point there, I have an officer whose role is predominantly to look at the COVID risk assessments for organisations. I've got 2 officers. One's looking at COVID risk assessments for outdoor events, switching the lights on, fireworks as what was, Christmas markets, etc. And another one is looking at COVID risk assessments for businesses and organisations. So if you find yourself in a situation where you're not sure what's the most appropriate, again, you can use my officers as that resource. Send us a message through, and you know, I'll happily get my respective COVID risk assessment officer to speak with you, go through your risk assessments if you need to make sure it's correct, or at least it's adequate, put it that way. You genuinely cannot be too safe, you know, too conscientious on COVID. It's horrible disease, a horrible virus, and it obviously affects those who are far more vulnerable and weak to it. We're just trying to put that barrier to stop it being so significant.
Well, actually, I was just thinking what might be really useful, Frank, is if we could maybe work with your officers and do some sort of outline templates.
Absolutely.
I think that will really help organisations if they've got the basics that they can then tweak.
Yeah.
To make their own, to make work for them. There
are a couple of variations on a theme already available, and I don't know what information you have access to. Certainly, the principles behind the risk assessments haven't changed. They've been in the same for the last 50 years. Okay, you identify the risks. What is the measures and so on and so forth. There are some specific COVID focus risk profile risk assessment templates and profiles. Some may probably be too excessive for some of the locations and events that yourselves are dealing with. Some may not. I don't know what you're planning, but certainly we do have a couple of templates which I'm actually trying to look on our website. We've got a number of IT issues at the moment at our place, so I do apologise if it goes a bit pear-shaped. But I'm pretty sure we do have some on our web pages, some information regarding COVID risk assessments.
That's great. If you could send the links, we'll get those out to everyone. I just think that everyone's obviously really time poor at the moment, so just having that best practice stuff will really help them develop their own. Super. Thank you. Anything else from anybody? All right, well, thank you, Frank. That's been really interesting and helpful. Yeah, on behalf of Lee, who can't speak at the moment and can't be heard, yeah, thank you everyone who came today. And as I say, we'll pop this on our new YouTube channel and send the link out as well. We've got an e-news going out this week with all the top tips as well that's been talked about today, and we'll pop those links in there so people that couldn't make it to this meeting can still access the information. So yeah, so stay safe everyone, and thank you, and yeah, have a lovely festive break.
Thank you for inviting me along. Thank you very much.
You're welcome. Thanks, Frank. Take care. Bye-bye.
Thank you, Frank. Thank you.
Bye.